Hi there, this is Jazmine Ramirez. I was in charge of finding a current event for Chapter 10 over long-term care. I found this article called Confined to Nursing Homes but Longing and Ready for Home by Katie Thomas, Sheri, Fink, and Mitch Smith, published on May 13, 2016 on the New York Times. And nearly 20 years after the Supreme Court ruled that disabled people requiring public support were entitled to live in their community rather than the institutions under the unless medically necessary, the federal government and states are still far from achieving this goal. Eve Hill states that people are not in the view, therefore it's easier to forget their quality of life through cases like Mr. Dawkins here and others are advocating for society to rebuild the side of healthcare differently. There are some states like Minnesota and Oregon in Washington that are making the strives to change where Medicare or Medicaid dollars go to, and that they're transitioning to home support and training caregivers and how to administer medication, to do the right exercises to keep their family members active. The article goes on to state that there are about 1.4 million Americans living in the nursing homes, and it's hard to tell who would be able to move back home, but there's about 400,000 residents that either have low need for 24/7 assistance or are of working age that could still contribute to society. Although this isn't the right choice for everyone, this is a growing popular alternative to living out one's days in a nursing home. At this time, 50% of Medicaid dollars are being spent in long-term care is now going towards services in the home over the community, compared to 20% in about 20 years from the past 20 years, which I believe does coincide with what we read in Chapter 10, how it is a very split between the main two splits is home care and nursing home, and then there's other obvious, memory care, communities, and so I think this transition between giving people a choice, especially if they're not, as we can say, elderly. As you can see, Miss Rodriguez here, she's 29 and is a resident of a nursing home. So, and she's obviously still able to provide to the society. Unfortunately, she's just confined to the nursing home, and also the expenses that comes along with. In one recent study, researchers surveyed thousands of former nursing home residents. They reported significant improvements in satisfaction and fewer unmet needs for help with personal care. However, more than 3/4 of them said they had visited an emergency room or been admitted to a hospital or nursing home during their first year of living in the community. I think this just goes to say that there's a great necessity for well-trained aides and caregivers. This is a daunting task for some, but it is doable with the right training and with the right funding, which is why I believe this is where Medicaid dollars should go into training and making sure that the caregivers have the right amount of training to make sure they take care of their family members. And I do understand that even though this might not be the right service for all people that are in nursing homes, and there is a great necessity for it still, I do believe that there has to be more of a quality over quantity when it comes to these kind of services, especially because it does take a lot to take care of one person with all their needs, because you have to think about if they're mobile, you have to take care of them getting up, going to the restroom, changing them, moving them, making sure they don't get sores, making sure that they are comfortable, making sure that they're being fed correctly and that it doesn't go the wrong way. There's just so many factors that goes into nursing care and also just home care. That's why I'm very passionate about this subject specifically. But I do believe that these people, even though it seems that they cannot be independent of each other or themselves, they do have the choice to be so, and I think that is necessary to give them that choice. I'm interested to see and hear what you have to say. I myself have my personal experience with both ends of the spectrum, and I do hope that we can discuss those in the comments. I do hope you have a great day.